Hey everyone, welcome back to the Health Insurance Insights Network. I'm Dinah, and I am so glad you're here today because we are kicking off something I've wanted to do for a whole year. That's right, it is officially Medicare Week on this channel. Hey! Now, all week long, we're going to walk through topics that are inside the Medicare You 2026 guide. That is the official handbook that Medicare recipients or their caregivers can order for free or download directly from Medicare.gov. This book is absolutely jam packed with everything you need to understand your benefits, your options, and the changes coming next year. And if you've ever opened it and felt overwhelmed, don't worry. That is exactly why we are doing this together today. Now, I'm going to be honest with you. This is something that I planned to do last year. Life happened, work happened, open enrollment season happened, and it kept getting pushed to the side. But the information is too important to keep waiting on. So this year, I am making it a priority, and I am excited to walk with you through page by page and topic by topic, and to help you feel more confident about your Medicare decisions. If you don't already have the Medicare You 2026 guide, you can still request a physical copy, or you could download the digital version at Medicare.gov. It's free. It's one of the best resources that Medicare provides. Go ahead, grab it now, even after this video, just so that you can follow along all week. I will be using the digital copy for the video. Um, Not really sure if I ordered a physical copy or not. It's been a busy year, but I will definitely be using the physical copy. It is the exact same as the physical copy, and we can walk through it page by page by page. Now, after you've gone through the videos this week, even if you don't get a chance to go through the videos this week, I want you to mark your calendars because this Saturday, right here on this channel, I will be hosting a live Medicare Q&A. We are going to walk through all the topics that you've seen in the videos this week or that appear in the book. I'm going to answer your questions. We are going to even walk through Medicare.gov's website together so you know exactly how to research your plans, compare your options, and find the information that you need to make confident decisions this open enrollment season. My goal here, guys, is very simple. It is to keep you informed, confident, and prepared. Whether you are a Medicare recipient or whether you're like me, you are a caregiver or a supporting loved one. That's me, a supporting loved one. Who is trying to walk through these decisions with a family member, you deserve clarity too, not confusion. So, this is going to help you as well. So, go ahead, hit subscribe, turn on your notifications, and join me all week long. It is Medicare week. And if you know someone else who can use this, share this video with them. We're learning together, we're navigating together, and you are not having to do this alone. I will see you in the next video, and I'll see you live on Saturday. Hey everyone, and welcome back to the Health Insurance Insights Network. I'm Dinah, and this week is officially Medicare Week on the channel. I've been meaning to do this series for an entire year, and I've finally carved out the time to sit down, walk through the Medicare and You 2026 guide with you, and make it simple. At least we're going to try. It is Medicare. If you or someone you love has Medicare and you know this book is Okay. Hey everyone, welcome back to the Health Insurance Insights Network. I'm Dinah, and this week it is officially Medicare Week on this channel. I've been meaning to do this for a while, really for an entire year, and I finally carved out some time to sit down and walk through the Medicare and You 2026 guide with you and make it as simple as we possibly can. Now, if you or someone you love has Medicare, you know this book is packed, it's free, it's detailed, and it's something every beneficiary should be using during open enrollment, even if you are working with an agent. And if you don't have a physical copy yet, don't worry about that. You can download it directly from Medicare.gov or you can request it by mail. Now, this week we're going page by page through the most important sections. Today's video is the big overview, everything up through page 14. So you're grounded, confident, and ready for the deep dives we'll do in the upcoming videos. Um, let's do it. All right, so on your screen, you should be seeing the cover of the handbook for this year. It is Medicare and You 2026, the official U.S. government Medicare handbook. All right, and we are just going to keep scrolling. On page 2, it discusses what's new and what's important. Check out what's new in Medicare in 2026 and important information to help you manage your health and wellness. On this page, it talks about capping what you're going to pay for prescription drugs. So if you have Medicare drug coverage, that's Part D, and we'll get to that in detail later. Your yearly out of pocket for Part D drugs is going to be capped at $2,100 in 2026. So once you reach this cap, you won't have to pay a copay or a coinsurance afterwards for any covered Part D drugs for the rest of the calendar year. It does tell us what page that information is on. It is on page 83. So as we get there, we will discuss this a little bit further. There's more drug cost savings for you this year. Um, we're, Medicare is talking about meeting your healthcare needs, and it's just telling you that they now pay for advanced primary care management services each month, where your doctor or your healthcare provider can coordinate and tailor care to your needs. Um, it talks about early detection matters because Medicare does cover a wide range of screenings. This one in specific is about colorectal cancer screenings, including computed tomography, which is also known as a CT scan, colonography. It discusses how getting screened is an important part of cancer prevention and early detection. Medicare is also on page 2 talking about helping Medicare fight fraud and cutting waste. Here is where you're going to have to be an advocate for yourself. This is where you want to monitor your EOBs. That's the little you'll get it in the mail, and it details what service you received at a doctor's office or facility. And what else is new and important? You can go digital with Medicare. You can have your Medicare resources at your fingertips. Where? Starting by what? Logging into and creating a secure Medicare.gov account. There you can manage your prescriptions, get your Medicare summary notices electronically, switch to the electronic version of the handbook, which is what I'm using right now. and more. You can also sign up for emails on the latest Medicare news. And hey, guess what? There's never been a better time to switch from paper to digital. If you're like me, I really do like to hold books in my hand. That may be me showing my age, but I like to physically hold the books. Um, but I can do a little bit with digital. All right, moving on. Page 3 is going to be the contents. The way that the contents is set up, it has a symbol key, and it shows you what's on each page. So what's new and important we just reviewed was on page 2. This is your index of topics is coming next. What are the parts of Medicare? That's going to be on page 9. That starts there. Your Medicare options start on page 10. At a glance, they are going to show us a comparison of original Medicare versus Medicare Advantage plan. And that's going to be on page 11. And then it shows you how to get started with Medicare, which is going to be on page 13. After that point, the book is separated into sections so that it can help to easily define select areas. Section 1 is signing up for Medicare. Section 2 is finding out what Medicare covers. Section 3 is original Medicare. Section 4 is Medicare Advantage plans and other options. Section 5 is Medicare Supplement Insurance, also known as Medigap. Section 6 is Medicare Drug Coverage, which is Part D. Section 7 is Get Help Paying Your Health and Drug Costs. Section 8 is Your Medicare Rights and Protections. Section 9 is Find Helpful Contacts and More Information. And Section 10 is Definitions that are helpful for you. Now, if you need this information in an accessible format or another language, then you can go over to pages 124 through 126, and it'll help to guide you through how to get this information. Now, for the sake of our videos, as I detailed earlier, we're only going to go up to page 14 in this video. I'm trying to keep these videos as short for you as I possibly can. 14 is probably still a lot of pages, but we're going to try to do it. And then for the sections, I'll do a video for each section alone. And all of these videos will post this week. All right, so let's move on. All right, as you see, page 4 is the index of topics. So if there is a specific topic that you would like to look up or check on, review here. I'm going to use colonoscopies as an example. It stood out to me. It's on page 36. So you would look up your topic, see what page it's on, go to that page, and review the information that's there for it. All right. And everything, of course, is an index, so it's alphabetical order. There are a lot of topics. All right, now we are going 4 pages of topics, actually, guys. So we are going to move on. We are now on page 9. What are the parts of Medicare? All right, here we are. Fun times. Part A is going to be hospital insurance. Hospital insurance is going to help to cover inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care. It does give you the pages that you are going to need to go to review this, which is pages 25 through 29. Moving on to part B, which is your medical insurance. This is your outpatient services. This helps to cover services from your doctor's office and other healthcare providers, outpatient care, home health care, durable medical equipment. When we say durable medical equipment, wheelchairs, walkers, CPAPs, hospital beds, other equipment. Many preventative services like your screenings, your shots, your vaccines, and your yearly wellness visits. If so, just to kind of break that down a little bit, if you do go to the doctor like you're supposed to, your primary care visits are going to be covered under Part B. And when you go see the specialist, that's going to be covered under Part B as well. Any outpatient procedures will be covered under here. There's more detailed information on pages 30 through 55. Now we're going to move on to Part D. As you notice, they skipped Part C. There's a reason for that, but we'll get back to that later. Part D is your drug coverage. It helps to cover the cost of prescription drugs, including many of your recommended shots or vaccines. As many of you are already aware, you're most likely getting those vaccines at the pharmacy and not the doctor's office, right? All right. Plans that offer Medicare drug coverage are run by private insurance companies that follow rules set by Medicare. Now, when we get to pages 79 through 90, we're going to find out more information about the drug coverage. So we are going to be very, very prepared for this. All right. Now we are moving on to page 10, where it discusses your Medicare options. When you first sign up for Medicare and during certain times of the year, you can choose how you get your Medicare coverage. There are two main ways to get Medicare. Original Medicare is going to be the first way. This includes Medicare Part A, as we just talked about, the hospital insurance, and Part B. You can join a separate Medicare drug plan if you get Medicare A and B, which is going to be Part D. So you're adding A, B, and D to get that coverage, right? You can use any doctor or hospital that takes Medicare anywhere in the United States. You can also use or shop for and buy supplement coverage that helps you pay your out-of-pocket cost. This is your 20% coinsurance. Now remember, Part A is hospital, Part B is outpatient. You can add Part D, which is your drug coverage, to this. Now you can also add supplemental coverage, which is your Medigap plan. With the supplemental coverage, it can help pay some costs that original Medicare doesn't. This includes Medicare supplement insurance, Medigap. We're going to go to page 75 so that we can learn more about Medigap. Or you can use coverage from a current or former employer or union or Medicaid if you qualify for it. What that means is if you are working, you can have a second insurance. If you are, let's say, if it was an employer sponsored insurance, if you are retired and you have insurance as a retiree that was through your employer, you can elect to keep that insurance. Medicare becomes primary, that insurance becomes secondary if you're retired. Now, if you are still working and you have insurance and you qualify for Medicare, then that in your employer sponsored insurance is primary and Medicare would be secondary. If you qualify for Medicaid, you can have Medicare and Medicaid. Medicare would be primary, Medicaid would be secondary. Now, when we get to page 57, we're going to learn a little bit more about original Medicare. Now, the other way is through Medicare Advantage. Medicare Advantage, remember, they skipped over Part C, is also known as Part C. It is a Medicare-approved plan from a private company that offers an alternative to original Medicare for your health and drug coverage. These plans bundle together your Part A, B, and D. So remember, with original Medicare, you need A, B, and D. But if you elect to have a Medicare Advantage plan, you are only have it bundles A, B, and D together. Now, you may need to use doctors in its network and get approval for certain drugs or services. This is not the case with original Medicare. Now, there are some changes coming there, but we're not going to focus on that right now. Usually, with Medicare Advantage, you have different out-of-pocket costs than original Medicare, including a limit on out-of-pocket costs, so you don't need to buy supplemental coverage like Medigap. So if you have a Part C Medicare Advantage plan, you do not need a supplemental policy. Most plans offer extra benefits that original Medicare doesn't cover, such as vision, hearing, dental, and more. Now, let's remember Medicare Advantage is Part A and Part B, and most of the plans include Part D, extra benefits, and lower out-of-pocket costs. Now, when we get to page 61, we're going to learn a bit more about Medicare Advantage. All right, let's move on. All right, at a glance gives us a side-by-side of original Medicare versus the Medicare Advantage plan. All right, under doctor and hospital choice with original Medicare, you can use any doctor or hospital that takes Medicare anywhere in the United States. You may pay more if your doctor doesn't accept assignment. This does include the 50 states, the District of Columbia, Puerto Rico, and the U.S. Virgin Islands, Guam, and Northern Mariana Islands. I'm probably saying this wrong. I'm a little bit Southern, you guys. And the American Samoa. Now, and in most cases, you do not need a referral to use a specialist if you have original Medicare. Now, if you elect to get a Medicare Advantage plan, Part C, you may need to use doctors and other providers who are in the plan's network and service area for non-emergency care. Some plans offer non-emergency coverage out of network, but typically at a higher cost. Now, you may need to get a referral to use a specialist. That is something you want to consider when getting a Medicare Advantage plan. All right, under cost for original Medicare. For Part B covered services, you usually pay 20% of the Medicare approved amount after you meet your deductible. This amount is called your coinsurance. You pay the monthly premium for Part B, and if you choose to join a Medicare drug plan, you'll pay a separate premium for your Medicare drug coverage. There's no yearly limit on what you pay out of pocket unless you have supplemental coverage, like the Medicare supplement insurance, which is Medigap, or Medicaid, or an employer plan, or a retiree, or a union coverage. And you can choose to buy Medigap to help pay your out-of-pocket costs that Medicare doesn't cover, like your 20% coinsurance. Or you can use coverage from a current or former employer or union or Medicaid if you qualify. Now, just to compare this to the Medicare Advantage plan, out-of-pocket costs vary. Plans may have different out-of-pocket costs for certain services. You do pay the monthly Part B premium and may also have to pay the plan's premium. Some plans may have a $0 premium and may help pay all or part of your Part B premium. Most plans include Medicare drug coverage, Part D, so you don't have a separate Part D premium. Plans have a yearly limit on what you pay for covered Medicare services, which may include different limits for in network and out of network services. Once you reach your plan's limit, you'll pay nothing for covered services for the rest of the year. You can't buy Medigap to cover your out of pocket costs. However, you may be able to use coverage from a current or former employer or union or Medicaid if you qualify. So, just to recap, you cannot purchase Medigap, but you can use coverage from a current or former employer or union or Medicaid if you qualify. All right. On page 12, it continues. For coverage with original Medicare, it generally covers most medically necessary services and supplies in hospitals, doctors' offices, and other healthcare facilities. Original Medicare doesn't cover some services like routine physical exams, eye exams, and most dental care. I want to back that up a little bit. Original Medicare doesn't cover some services like routine physical exams, eye exams, and most dental care. There are some of you out there who don't realize that you don't have vision or dental. In most cases, you don't need approval, which is a prior authorization for original Medicare to cover your services or supplies. You can join a separate Medicare drug plan to get Medicare drug coverage, Part D. Um, when compared to Medicare Advantage, with Medicare Advantage, plans must cover all medically necessary services that original Medicare covers. Now, these plans may also cover extra benefits that original Medicare doesn't. This is where these plans may cover your physical exams, your eye exams, your dental care. You may need to get an approval, which is a prior authorization from your plan before it covers certain services or supplies. These are your surgeries. This is your radiology, any imaging, your medications. Most of them you will need authorizations. Um, Most Medicare Advantage plans include a Part D, and you don't need to join a separate Medicare drug plan. And finally, foreign travel. For those who like to travel abroad, original Medicare generally doesn't cover medical care outside the U.S. You may be able to buy a Medicare supplement insurance policy that does cover emergency care outside of the US. But for the most part, just so you know, original Medicare generally does not cover it. With the Advantage plan, these plans generally don't cover medical care outside the US. Now, some plans may offer an extra benefit that covers emergency and urgently needed services when you are traveling outside of the country. All right, now the 2026 premium amounts. Well, actually, when I printed this, they weren't available. So I'm going to go back and get them for you. All right, page 13. Get started with Medicare. Make sure you understand your Medicare coverage options. There are two main ways to get your Medicare coverage. That's going to be Original Medicare, which is parts A and B, and Medicare Advantage, which is part C. Those are your options. So go to pages 10 through 12 in your books and compare. Learn everything you can. We just went over it, but read it again until you understand it and compare them, because you need to pick what is best for you. Find out how and when you can sign up. So if you don't have Medicare Part A or Part B, on page 15, it is going to tell us when and how to sign up. If you don't have Part D, on page 79, it's going to tell you when and how you can sign up. Know how Medicare works with other insurances if you have it. On pages 19 through 22, that's where you're going to go to find this information. Review your Medicare health and drug coverage each year. Make sure it still meets your needs and decide if you want to make a change. You don't need to sign up for Medicare each year, but you should still review your options. This is important. Every year, I know you get a lot of phone calls, but you should still be reviewing your options even when you are working with an agent or broker. Now, on page 13, it also gives us the key dates. Some of these dates have passed, but we are still within some of them. On October the 1st is when they say you should start comparing your current Medicare health or drug coverage options for 2026. Did you hear that? October the 1st, not November the 1st, not December the 1st. October the 1st. Every year when October the 1st comes, the information is populated on the site so that you can compare. October the 15th through December the 7th, this is your enrollment period. So during this period, you can change your Medicare health and drug coverage for 2026 if you decide to. You can join, switch, or drop a Medicare Advantage plan or a Medicare drug plan, or you can switch to Original Medicare during the open enrollment period each year. On January the 1st, new coverage begins if you made a change. If you kept your existing coverage and your plan's costs and benefits change, those changes also start on January the 1st. So you want to contact your plan if you don't see the changes in your account after 10 days into the new year. From January the 1st through March the 31st, this is a different enrollment period. But if you are in a Medicare Advantage plan, you can change to a different Medicare Advantage plan. Or you can switch to Original Medicare and join a separate Medicare drug plan once during this time. Only once. Any changes you make will be effective the first day of the month after the plan gets your request. There's more detailed information on page 63, so we will discuss it when we get there. During this period, you can't switch from Original Medicare to a Medicare Advantage plan. During this period, you cannot switch from Original Medicare to a Medicare Advantage plan. You can't join a Medicare drug plan if you're in Original Medicare, or switch from one Medicare drug plan to another one if you're in Original Medicare. Important on this page, You may pay more if you don't sign up for Medicare when you're first eligible. We'll find out more about that on pages 22 and 23 for Part A and B, and on page 83 for Part D for more on late enrollment penalties. You don't want the penalties, you guys. Sign up when you are supposed to. Okay. We have made it to our last page. We are on page 14, and we are still talking about getting started with Medicare. Um, on page 14, here we are at Explore Your Options. You can find and compare health and drug plans on Medicare.gov. You can call 1-800-Medicare. You can get a free personalized health insurance counseling from your state health insurance assistance program. You can go to pages 114 through 117 for the phone number of your local. I do want you all to know that this book is based on your local. When you sign up and when you request it, I believe they do ask for your zip code. Um, Very important. So if you know that you are moving to another state or something like that, you want to consider all of those things. A trusted agent or broker may also be able to help. Visit Medicare.gov. Health drug plans, health plans, your coverage options, plan marketing rules to learn more. I'm just going to say visit Medicare.gov. All right. Get help paying for healthcare. There are multiple programs available to help with costs, and many people with Medicare do qualify. We're going to learn more about that on pages 91 through 95. And again, Medicare talks about going digital. They talk about logging into and creating your secure Medicare account at Medicare.gov so that you can switch to the electronic handbook. That is what I am using right now. Um, they will email you a link to this PDF version instead of sending you a paper copy in the mail each fall. If you have a smartphone or an e-reader, you'll be able to take the handbook with you anywhere you go. If you are using your Nook, or I do use my smartphone from time to time to read, but I really do prefer holding books in my hand. All right, so we have made it to the end of our overview. We will move into our sections. Our first section is going to be signing up for Medicare. That will be on the very next video. So thank you so much for watching. Subscribe, 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 and like so that you can get your notifications. All right, I will see you on the next video. Thanks for watching.